I don't stand up here and speak to you on behalf of myself today. I speak on behalf of nurses in this beautiful state and nurses in this country, because this is an ongoing issue that's progressively getting worse. Emergency departments are beyond capacity every day. There are no skilled nursing beds for your grandmother that you can no longer take care of. There are no pediatric intensive care unit beds for your child within a 6-hour radius of your home. There are no ambulance resources to transport your husband to a major medical center to receive a life-saving stent when he has a heart attack. And there are limited to no coordinated mental health services in this state. This forces EDs to board patients for hours, days, or weeks. All of this leads to an increased risk of violence. I've been spit at, kicked, bit, had my hair pulled, been sexually harassed for hours on end, had my life threatened, and on one occasion, I was being stalked by a patient who threatened my life with a weapon that was later recovered in his vehicle after he was brought to the ED on a mental health warrant related to a threat to commit a mass shooting, and there was probable cause to believe that this was legitimate. I just want to be clear. He was transported with 4 armed police officers. The community was put on lockdown. Law enforcement agencies across the state were called in for support. And he was dropped in my ED with a team of 6 nurses, all of them female, and not a single one over 130 pounds. He proceeded to terrorize our staff for days before a mental health facility would even consider taking him. He was deemed too acute. There weren't enough resources at our inpatient units to care for him. Shortly after his release from a brief inpatient stay, he began showing up in places where I was. This included the dirt road near the driveway to my home, the home that I was in with 2 small children. There's nothing that compares to what we're going through right now. And, you know, what's going on in our emergency room and those across the state, we're literally under siege every day. Every day that we come to work, we're under siege.